So a little bit of country context as a background. Many of you would know, but Ethiopia is located in the eastern part of the country, commonly known as the Horn of Africa. And it's been a while since the national census has been done, but with the global estimates that we have, this is a current estimated population of close to 130 million. It's a federal government, which means there is a decentralized regional and local governments with very diverse, both topographically, but also with ethnic groups, language, and culture, with up to 76 identified ethnic groups in the country. It's a very young country, as many of the African countries, about median age of 19, and 70% of the population being under 29 years old, and also a large number of under 5 children, of 15%. Women within a productive age group account about 23%. The total fertility rate is currently around 3.9, which is a big progress in terms of a decline in the fertility rate from about 6.5 in 2000. And to also give context in terms of our topic today, in terms of women in leadership, one of the things that I really like on the what's written on the website is about the overall challenge we have within gender equality and inequities and inequalities is about structural issues. And one of the big structures that we look at in this topic is the governance. And women's equal participation, particularly in leadership, fortunately has been top on the government policy agenda for quite some time, maybe almost 20 to 30 years, we can say. And that is really critical to set the tone of what happens at different levels in the country. And this starts from, of course, ratification of international and regional instruments that we can name a lot, like the Beijing Declaration, the CEDAW, and many others, but also a number of national instruments and legislations that really support this, some of them in general, some of them explicitly, which just to highlight some of them is the women's policy, the national women's policy, the constitution itself that has been there since 1995, National Action Plan on Gender Equality, and a few others that state prioritization of this agenda of women in leadership. And then when you come to the national plans that the government has, the earlier plans is starting 2011, which is called the Growth and Transformation Plan, actually started to explicitly put some accountability to different levels of government in terms of what should be the representation. So increasing 50% of women's representation at the federal level for legislative branch, and then 40% for executive bodies, and then 35% for judicial system by 2030. This was what was put nationally, so that all entities would strive to that. And then in 2018, when there was a government reform, this was again announced as a government priority. And of course, it was also the showcase was that there was an appointment of the first woman president, the first woman Supreme Court judge, and then the chairperson of the National Election Board. It's interesting that today, as I am giving this talk, actually we had our woman president. She finished her term and today handed over to another president, but it's a male president now. And then the Supreme Court judge, of course, was also, after about 4 years of service, she has been changed to a male Supreme Court judge. So we'll, of course, have to continuously see how this is sustained. It doesn't mean, of course, we will not have women and men come to this, but the overall mix. And that time was also where the appointment of the cabinet ministers really increased to 50%, which was the first for the country. And we're now at around close to 40% now. It's slightly declined, but it's still maintained high. So this commitment at a national level was really a drive for most of organizations, both at the federal and subnational level, to push this agenda. But although this was really definitely a great progress, but it was not yet similar at the different levels within the government, especially when you go down, and also in the different branches of government. So you can see here there's three: the legislative, the executive, and the judiciary branches. And interestingly, it was significantly high in the legislative branch, where was at the federal, the House of Representatives, and the regional, zonal, and district level, which is mostly based on election, and also there's enforcement of representation. You can see it's much higher. But when you go especially to the executive branches, it's definitely much lower, around average of 20%. So it still shows that there's yet a lot of work ahead. And some studies also showing some comparisons of ministries, organizations. This is the one that shows the Ministry of Health, the Ministry of Agriculture, and the Environment, Forest, and Climate Change Authority of Ethiopia. So the percentage of women at the senior, middle, and junior level, which you can see there is at the junior level, for example, the Ministry of Health has good that shows higher, and the middle level for the Ministry of Agriculture, but overall still much low for the Environment Ministry. But this was a big target, a big push. When you see the government at the head, as a head of state level, pushing the agenda, it was a driver and also an accountability mechanism to all entities to really push this intentionally. Because one of the words that I really like in terms of achieving gender equality is really the intentionality it requires in really addressing different issues, both the mindset, the culture, but also structural issues that need to be addressed. So again, it's encouraging progress, but it definitely shows a long way to go. And when you come specifically to the health system, to the health sector, women make up approximately about 75% of the health workforce. This is in most countries, but also the same in Ethiopia. It's about 70% of the health workforce, which includes our large community health workers, midwives, nurses, physicians. So this counts a large number of the workforce. But when you look at, again, representation at leadership, at the different levels of leadership, it's very limited. And when you look some of the index overall of what affects women's empowerment and leadership, there's the African Development Bank that has developed the Africa Gender Index in 3 areas, which is the social, the economy, and empowerment index. And when you look at the social dimension, which measures inequalities in both labor market participation, wages, incomes, business ownership, and so on, for Ethiopia, the score was about 0.54, indicating that still we have a long way for parity. But when you also again look at the score for empowerment and representation, it is again much lower than even the economic dimension, which is about 0.247. So that shows really decision making by women remains to be substantially low, both in public and private sectors. So what do we do, and why are we really talking about this, and why do we have institutions like the Women in Public Policy Program and others who really work at this? I mean, this is something we all know, but it's always important to repeat it. It's about, of course, equity and equality, but it's much more than that. It's not just because we need women to have the space and also to have a level playing field, but it's because we need women in those places. We need, when women are more empowered to lead, it's because everyone benefits. And this has been documented time and again by so many research, that there are so many key areas that women really excel at to bring to the space progress. And it can be demonstrated in many ways: in performance, in developing trust and collaboration. And many institutions with women leaders anticipate and also report fairness and inclusive development. So It is because it's important for the holistic development of where we want to take our communities, our societies, and our nations. So, and then again, I will talk a little bit on, so what should we do? What have we been doing as a nation and as organizations to address this? Again, I will talk more on the structural issues, but also reflect on some of my own personal experiences around the end. So in terms of the structural issues, I think one of the basics, I think, before we even talk about empowering women into leadership roles at different levels, the big challenge for countries like Ethiopia is even the number of women who access education, the basics. So the government has really focused on enhancing access to education to increase enrollment in primary and secondary education, where we have seen a lot of progress. So the enrollment rate for girls have increased from only 51% in 2003, 2004 to 94% in around 2016, 2017. But again, this is enrollment to primary school, which is what for the definition for our country is up to 8th grade. But only 61% of girls complete primary school. And unfortunately, it's only 25% of secondary school age girls who attend secondary school. So you can see how we are still far in terms of attaining that level of education to really have women in the different leadership roles. And there are so many factors that impede that, of course, especially our country is largely a rural population, which has impacts in this regard, and with child marriage still very high, as the DHS in 2016 shows around 40% of girls get married in their teenage years, or even sometimes lower, even though legally it's illegal. I mean, there is a proclamation which makes it illegal, but it's not really, it's a very difficult issue to enforce across the country. Early pregnancy, again, child labor issues, distance to school, availability of facilities, even once they are in school, which hamper the quality of education they get, or and issues like gender-based violence, and the different types of population we have, like pastoralist communities where there is high mobility and really the attainment of school is difficult. And again, with a different challenge we have now with displacements and so on, these are also again challenges. But there is continued government investment in increasing access, but also in making communities accountable in terms of really sending children to schools, like women development groups at community level, where there is a social accountability mechanism for families to send their children to school, but also has different packages for health, for education, nutrition, and other components. And then when you look at the higher education, there was a proclamation that came out in 2003, which has an affirmative action as part of its legislation for female and other like those with disabilities. And there are few regions which have disparity, which I'll show later on, where there is also this kind of affirmative action. So it is through proclamation that this was enforced to enhance the enrollment of girls into higher education. And there is also regional disparities when we're talking about the access issues. Is within the country, there are also regional disparities based on the different contexts of the regions in development, the pastoralist regions. Also, if you see places like Afar, so there is this is the gross enrollment rate of girls, even for girls and boys in general, there is regional disparity. So that's why the affirmative action also included to address some of the geographic and disparities as well. So the other is we need to intentionally, again, create enabling environment. So an organizational culture that really upholds women. So that's one of the things progressively that has changed. For example, maternity leave used to be about 6 weeks and progressively increased to now 4 months in the government. So for anyone working in the government, and it is enforced for those in the private sector as well, is 4 months. But also, it's not just about giving the maternity leave. women, when they're out for their maternity leave, they're considered that they're away from work as if they are not performing well. So they should not be made to feel guilty or sometimes even sent some work during maternity leave, but respected in that regard. And this is a culture that we are trying to work on in my ministry as well, and as in different institutions. But that was definitely one area I used to emphasize. And just to highlight another example of really how the organizational culture really should reflect, women should feel empowered to live like a woman, but also lead, because we cannot change. I always try to tell my women colleagues, we have to lead. If we are leading as women, we have to lead as women, not lead as men. We have to keep ourselves as women. And we used to have a management meeting from 7 a.m. to 9 a.m. every Monday. This was a consensus before when it started to utilize our time better. But then it increasingly became challenging and some were complaining. So we agreed to discuss and decide on what is the best time to change it. Most still agreed that it should start early. And then at the final stage, most of the men said, okay, let's keep it at 7 a.m. because it has been effective. But then few said that it's really not, let's make it 7:30. So I asked the woman, does a 30-minute make a difference? And it was clear that it made a big difference. That 30 minutes in the morning made a big difference for the women because they had to handle a lot of house issues before they come. But it was not so much impactful for the men. I mean, not everyone may be having similar responsibilities, but that was a general consensus. So we agreed we are going to change it to the new time because it does make that difference for the women. And then the men we respect that. And so these kinds of really actions really set the tone and the culture of respecting that, because it's not only about bringing women into the leadership role, but having that enabling environment to keep them in those positions, that is really critical. And then establishing daycare with maternity rooms. This was not actually only what we did. This picture is when we inaugurated the daycare within the ministry, but this was actually also part of the bigger policy reform that was happening in all organizations that the Ministry of Women was actually overseeing. But this was something that was really important for many women to feel comfortable easily having caring for their children within the ministry. And we continue to do that in different institutions within the health sector. And government also put in this proclamation for civil servants, which gives special attention to women candidates in recruitment processes, gives if they are, for example, have difference of 3% in their grades, then it's up to that person, then the woman gets the selection. So such kind of structural things that really enable environment, but also having that intentional change of culture was important. Well, gender mainstreaming both in policies and in institutions was a clear action that also was very important. There are gender units in all government institutions. And this is really important to help us see do we have gender lens in our policies, in our programs and interventions, but also in our institutional activity. So trying to push us towards gender transformative, because this is an area where sometimes when we are doing specific initiatives, we get really gender blind about it. And we have to have those kind of units who come and can really awaken us to look at this and have we seen the gender lens in this area. And also important, we have done gender audits through these units, which was really critical in terms of looking at how we program, how we budget. But it was unfortunate that when you're working for different areas, you get a lot of budget. I mean, it's easier to get secure budget for different initiatives, but we had to wait and look for 3 years to get budget for gender audit. So you see, still there is a challenge of prioritizing this agenda again. And also these units have been critical in following up of how we applying these affirmative actions that are given through legislations, but are we really practicing them? And also the key issue of having policies, trainings, and reporting mechanisms for harassment and gender violence was something we introduced through our gender unit. It was really a new thing to even become comfortable about discussing. And probably for countries like the US, this is something I've been doing for a long time, but it's not something that's easily discussed upon in institutions like where I was, or in many Ethiopian institutions, or maybe similar African countries. But these were key in pushing this agenda. And also establishing women forums. We have women forums that meets every quarter, and also they would call upon different leaders within the institution at different levels, or the agencies under the ministry, to come and share from their experiences to other women, because there is not so much opportunities for junior professionals or others who are in different facilities to interact with different even if they are few, those leaders who are at different levels, to interact and share. And this has been really impactful in having those kinds of opportunities for them. And the other critical issue is how intentionally designing development programs, women development programs, leadership development programs. So I'll talk about one specific one that we were working on, but before I go there were also different national programs that were being rolled out. One was a presidential leadership program for women leaders, which was a flagship initiative of Her Excellency President Sahle-Work, of the Ethiopian president, which targeted middle-level women leaders, both in public, and the ones in public were at both federal and subnational level, but also included those from private sector and CSOs. And they had 6 cohorts of trainings, and really became impactful for many women leaders. And there are another program launched by the Ministry of Women and Social Affairs. This was also open nationally with the objective of really creating a pool of women leaders by providing this kind of targeted capacity building training programs. And for the health sector, we also saw that this is something we intentionally need to work on. But of course, the leadership development program was not only this leadership incubation program is what we developed in 2019. It's a 6-month program designed to develop emerging leaders, but it targeted at least 60% of it to be women. And it started from the recruiting from the federal institutions. And this was because when we were trying to assign different directors or leaders for either it could be team leaders or agency leaders, what we noted was we're always trying to search where do we get who can take this role. And when there's especially high turnover and you don't have a pool that you can quickly go to. So this was targeted for those who have motivation to take this kind of roles. So there is a selection process which shows that there is initiative from them, and that the approach was a collaborative project of the ministry with an Institute of Primary Healthcare under the ministry, but also AIHA. This was supported also by the Bill and Melinda Gates Foundation. And it was a lot of hands-on, in addition to having leadership courses, hands-on problem-solving projects, but there was also a lot of coaching, networking, and the trainees were allowed to shadow other leaders. And I was fortunate to be shadowed by at least 2 of the cohorts, every cohort. And it was really a great experience, not just for them, but also for us who were being shadowed or who coached the trainees. So this was really a program that was impactful, but we are trying to expand it to the nationally. Although we are recruiting from the subnational as well, we can only take few. So we are trying to replicate the programs in universities so that the access can be more. So I also sharing my individual experience in this, both in terms of my own leadership, but also as a leader in terms of recruiting or mentoring other leaders. So myself, I'm fortunate that my background, my parents were educated, so they were very focused on our education, and both myself and my male siblings, I never saw any difference among us. So that's how I grew up. And then, of course, my passion was medicine. I studied medicine, and I never thought I would shift to leadership or public health in the way I did. But it was a role of mentors, which had a really huge impact on my journey, as where later I subsequently took different leadership roles. And I really wanted to emphasize the role of anyone at any different leadership. It could be a middle level or a high level leadership, the impact we have on others, even the smallest thing, the smallest feedback or support we can give, it has a huge impact. For me, it was, fortunately, it was, I had presented a speech, and then it was somehow, it got to the minister at the time, who was the current DG of WHO, Dr. Tedros, who saw that and called me and said, from your speech, I can see you have a leadership potential, so consider taking on this role. And that really is something that opened my eyes. And I said, I only thought I would live a clinical life or work in treating patients. But he said, no, I see more than that in what you can do. And so take this challenge, take this opportunity to lead a teaching hospital where we are about to launch a reform. But also it's a hospital, but to become a teaching hospital. So because I always had also some inclination to work in initiatives for improvement projects in the health system and so on, I said, okay, I'll take this challenge, although it was never my intention or it was never something I had experience with. But it also takes me to the point that our education systems also, although I should also really cater towards building leaders from the young age, which is something that is lacking in most of the education system. But I was fortunate to have this kind of person who really was intentional about giving this feedback and this opportunity for me. And then, of course, that shifted my whole journey, and I'm grateful for that, having the privilege to serve in many leadership roles. But then it was also the motivation to make a difference that was a driver for my role. And the other point I would like to share, especially as a woman leader, is the challenge of the general norms versus your personality. That in most countries like ours, I was talking with another leader actually this week about this. It's the common notion is a very strong leader has to be an autocratic leader, and for most women, we usually have a collaborative approach. And I remember when I took role as a minister, one colleague who said, "You're very collaborative, and I worry if really people would really listen to that approach." So of course, I was concerned about it. There are skills I continue to develop in terms of being assertive, but I cannot be a different person. And a collaborative leader is also is actually a leader that we all want to be. So I said, okay, this is something I will develop, but I will not change who I am to be a good leader. I will strive to be a good leader, but I cannot change who I am to be a good leader. So that's what I said earlier. Also, what some of the challenges women leaders face is to push them to shift to become somebody else, which I don't believe is the right way. Of course, all of us have to continue developing our leadership skills, but being ourselves is, I think, something we can give to others as we lead authentically. But also the other notion, the other point I wanted to make is about my experience in terms of mentoring and recruiting other women. Again, it requires intentionality to mentor and recruit other women. And that has been one of my experiences, which I hope I would have done more, but because of the time limitations, I don't think I mentored enough women. But one of the challenges I faced, I remember that I would like to share, is recruiting other women in positions where we are appointing, not in competitive, because we have positions where we appointed, like agencies where we appoint director generals, and there are others which are competitive where it would be selection process. So when I'm looking for women to be appointed, I remember we had about 4 vacancies, and for one of the positions, I had to speak to 5 women to get to a yes, because they are all capable women, but they would, one challenge is definitely the family responsibility. So they would say, if I'm taking this role, it will be too much responsibility. But some of the other was, they set very high bars for themselves. So they would say, I don't think I would be able to deliver as much as that position requires, which is something I really respect. But we also have to really push and say, okay, it's not because they are not capable, but because we set the bar too high. And that has been one challenge that I think collectively, as especially big institutions like the WAP, can really help in helping women really go and push themselves to really take on those roles. And the last point I would like to make is, for any woman leader to succeed, I think the personal support she gets is really critical. For me, I cannot overemphasize the role my husband's support had in my journey. And I have seen in many, it could be research or personal experiences, that's the same for many. I've seen it when it supports and makes women successful, and I've seen it the other way. I had one director under me who was a very vibrant leader. I saw her as an expert, and then slowly giving her responsibility. She became a director. She was really vibrant and making a lot of change. And then one day, she never came back. And it was a big shock for all of us. And when I asked, her husband is a business person, and the only thing I could get, she couldn't even speak to us, but the only thing I could get was she's not coming back, not only for the position, but totally to the ministry. She has stopped working and now stayed home. There is nothing wrong with staying home. I mean, I'm not against that, and that's something I usually say to my friends. I really miss. I wish I could have time to do and stay at home and take care of my children. But it's only when it's her decision and when she's willing to do it that it's perfect. But if she's forced to do it, then that's really the saddest thing I could see. So I have seen it for myself. I'm fortunate, and again, my husband supports me he's also fortunately a leadership coach, but also has always even pushed me when I say no. Sometimes he would push me, saying, you can take this, you can do this. So that has been really critical in my journey as a leader, and is really critical from all the experiences I have seen. So the male involvement, not just at institutional level, but also at home, is I think a source, something that we cannot overemphasize. So I'll stop here, maybe, so that we can have time for discussion. Thank you so much.
Thank you so much. That is such a message on my screen. That was very, I have so many questions. I think other people will have questions in the chat. Please enter your questions, and then we can pass them on. You touched on so many compelling perspectives, from the level of national change to the level of leadership to your personal journey. And I'd love to go back and start with the national perspective if I could. I have so many questions, but it's really compelling. You've got this, can I go back to your slide? I'm looking over at my slide. I took a quick photo of your slide to remember, but you wrote that Ethiopia's growth and transformation plan included equal participation for women. You have this 2018 government reform. You have these gender quotas. What's the backstory on how you got there? Like, how did you get to a place where the government was committed to do that type of, make that type of commitment at an institutional level?
Yeah, that's a very interesting question, which maybe I may not answer it very well, but definitely the shift was really something you can clearly see. So when I mentioned about the legislative, the parliament, which has reached about 40%, if you see in 1995, it was only 3% of the parliament that were women. So you can see how big a shift what it was, although it was not an immediate shift, but progressively it became a huge shift, and it was within all the policies that really that was really instrumental, because if it was not in the legislations, it may not have that strength in terms of the power. But there were also a lot of actors in that. There were a civil society, and in the beginning, it was part of a government reform, but also there were different entities, community civil societies, who have played a role in that. But also, I think government commitment at different levels that really brought those changes. But engagement of the civil society is something maybe I have not mentioned well earlier, which has been key.
That's terrific. I think that's there. There are numerous cases of where reform or this sustaining of reform has rested on the activist, a lively, active civil society, particularly women's leadership within civil society. So that's very exciting.
Ethiopian lawyers, Women Lawyers Association is one thing I would cite, but there are others also, women associations that were key.
That were key. Let me get this. I want to see if there's any. Let's get Luana in here. Luana, Anisha, I don't know if Luana would like to unmute, or if we should just read her question. Did you check in with her? Oh, hi, Luana. Are you in a position to say your question, or would you like me to read it?
Sorry,
terrific.
I'm not
Join
at
us.
home. So if you could read it, I don't think
Okay,
I
I'll
have
read
a
it.
good
Terrific.
internet.
Thank you for sticking with us, even when
Thank
you're
you.
She said, I'm really interested in your trajectory and which relations networks you accessed you think had the most impact in your path to leadership positions. So you mentioned once this, it sounds like a senior person within the government had played a really important mentorship role, if I understood that correctly, the person who saw you give a speech and said, I really would like to recruit you in. But what were some of the others? I mean, were there other ways in which you were systematically connected or connected through your work to people who pulled you out and gave you more visibility as a potential leader within the community?
Yes, yes. Of course, there are different ones I have not mentioned, but it starts, of course, from my teachers when I was doing a residency program, who were also mentors, but also what you can call as sponsors. But additionally, when I was also leading the hospital, working as a hospital leader, I had established different partnerships with organizations within and outside of the country. And one colleague who was working at the University of Michigan, where we started partnership, was also another person who was a mentor. Many of you may know her, Professor Sanaif Sa, who was key for the partnership we established to develop residency programs and reproductive health training programs. But in addition, also being herself a global health leader was also a great mentor, and also had, because of that partnership, had the opportunity through her to take other roles, like leading a Center for International Reproductive Health Training at the University of Michigan. And this, it was, as a woman leader, another mentor was, her mentorship was really key. And there were others who may not have mentored me specifically, but also had a big impact for me. For example, as a gynecologist, I worked a lot with related to fistula, and it was, maybe some of you may know her, Catherine Hamlin in Ethiopia. She had worked a lot on averting fistula, days from fistula, and morbidity. So she was a great role model for me, not a mentor, I can say, but as a role model with her dedication and leadership. And there are a few others that I can mention, but it's also an area where I think consistently where we lack, even for myself, having a mentor in every step of the way is still something most of our upcoming leaders really lack. And the misperception could be that when we are thinking about mentoring people, we always think we have to have a long-term commitment and withdraw ourselves from that. But even giving the smallest time possible for women who work with us is really, it has a huge impact. Even it could be just 1 hour that we give them through in 1 year, but that would have an impact in the woman.
Sometimes leadership scholars distinguish between mentors, like you described, who are with people for years, and sponsors who open doors, and that it's critically important that women have both. Abeba, I hope I'm pronouncing it. When I call you, and then Anisha, could you check in with some of the other folks who have questions to see if they want to be unmuted or have their questions read?
Yes, and Abiba, I just unmuted you, so feel free to ask your question out.
Can you hear me?
Yes, we can.
Thank you, Hanan. Thank you, Dr. Lia, for your informative presentation. I'm Abeba from Ethiopia, professor of higher education from Addis Ababa University, and I'm also happy to see some of my former trainer like Ron. So, Dr. Lia, I also agree that, in recent years, women have made significant progress, particularly when the new government came to power. And it's so interesting to see women like you in gaining senior leadership positions across different sectors, not only in the health and the other two sectors that you mentioned as an example, but also in the higher education sectors in Ethiopia. However, based on the research that we conducted, I particularly conducted, and based on the practices, can we say that the main reason for the Ethiopian government involving women in senior leadership is based on more on tokenism, which is what I call representation and political correctness, than in believing what women can bring to, to the leadership, or what they can contribute as leader? This is my first question. Of course, you may say based on your experience, but I'm asking whether how the government have been thinking when it brings women to senior leadership like minister, state minister, and directors, and so on and so on. And I also highly appreciate the increasing opportunities for developing women leadership capacity, both in different sectors, including the education sector where I work. But why do you think most of the women leadership capacity and building initiatives in Ethiopia, including the Ministry of Health, are often a one-off activity that fails to be institutionalized? And the way that when we study, we found that it's more of depends on who is in power, rather than leaving a system that contributes to enhancing opportunities, providing opportunities for incumbent leaders and future women leaders as well. And my final question is, as you said, you are lucky to have a mentor who is very willing to groom you to be a senior leader. But do you think that's also the case? We found, because one of the serious problems that we have here in Ethiopia in different sectors is lack of mentorship. And can we say that still it's one of the major problems across different sectors. And do you agree on that? Over to you. Thank you.
Thank you, Ababa, for all the important questions. I think the last one, I think I've tried to address a bit an earlier question, which is definitely, as I said, a challenge that we need to work on. In terms of the tokenism, so I may not be able to speak on overall how or why the assignments are made, but it could be a bit of both. Because there is, it is a commitment that the government takes, then assigning women is intentional action that the government is doing. But people are the ones who are assigning. When we are talking about the government, it's people in leadership role who are assigning other leaders. So everyone can have their own biases. So there could be an element of tokenism and an element of really believing that this would make a difference. But I think ultimately the most important thing is that once the women have the role, they also take it. But it's a process. I don't think we can have a perfect process, be it with that intention or with the intention that they would make a difference. Having women in the leadership role is very important. And then once women are there, of course, they also have to work hard in terms of delivering that. But usually also the bias is not only because of tokenism, but also how they view once the women leaders are in the position, how they're viewed is also a problem, because some view them, it's because that's why women have to really work harder to although they are performing the same with another counterpart of a male, they may not be seen similarly. There is high expectation for women, or even if a man fails, it's not seen similarly as if a woman fails. So there's more pressure on them, but that's something we all, again, it's a process again that we all have to pass through. But I think whichever way it comes, as bringing them into the space is really critical. And it's through the delivery that will continuously change. The mindset of men will change when they see women delivering, and that cannot happen if they don't have the position. And the other one, in terms of the activities, yes, that's another challenge. Definitely, the activities not being sustained, but that's something we have tried at the Ministry of Health to ensure that this is a program that has become institutionalized. The Leadership Incubation Program, we recently have tried to, it started with the funding. That's another challenge. If you start such programs with an external funding, sometimes they stop when the funding stops, but making sure that you have a sustainability plan is really key. So that's what we have tried to do for the Leadership Incubation Program, to be institutionalized under the Institute for Primary Healthcare, so that it can continue without that specific funding. There may be other funds that it comes. It can even generate revenue because they are a training institution. So that planning from the initial phases to ensure that a sustainable program is absolutely key. Thank you.
Thank you. I just want to pick up on, I mean, I think going back to the end of your response goes back to the beginning, right? Because to the need for mentors. And I think you were saying that this leadership development program is inclusive of people from all genders, right? Yeah. So it's really for the whole sector, which is very exciting. I wanted to just insert one piece of research by our former colleague, Rohini Panda, and then the Nobel Prize winner, Esther Duflo, that reinforces your comment that bringing them into the space is key. And what they showed was that quotas for women in leadership in India had effects 10 years later. So the effects were not immediate, but 10 years later, it was changing families' behaviors toward their children in terms of the girls. They're allowing the girls to go to school, maybe do less housework, investing in the girls, because after a decade of seeing these women in leadership positions, attitudes were changing. So I just wanted to add a little more data from our community to reinforce your point. I'd love to bring in Jalikatu. Am I saying the name right? Forgive me if I'm. I'd love to bring you. Can we unmute you here, and you'll correct me because I'm sure I got that wrong.
Yes, hi. Thank you. Jalikato is fine. Can you hear me?
Great, thank you. Yes, we can hear you.
Okay, thank you. First of all, I wanted to say I'm very lucky to have recently acquired Dr. Lia as a mentor. And thanks to the Harvard Lead Fellowship, I'm a new Harvard Lead Fellow. And this will be the first time I'm getting a female mentor. So it really means a lot. I'm really happy to be here. Thank you very much, Dr. Lia. I also wanted to quickly say Sierra Leone's are very similar to Ethiopia's challenges. So I identify with a lot of what Dr. Lia was talking about, and wanted to quickly comment on the comment of women's giving role in leadership being seen as tokenism rather than the government actually believing in these women leaders. For us, for the very first time, we have a president who has been intentional about bringing women on board and has made it a constitutional right to have women representation in leadership. And yes, the previous speaker was right that many people, I should say mostly the men, see it as tokenism, but for the women, it matters a whole lot, and we're very happy about it. And you would see that in 4 years since we've had this president and this intentional, move to bring women to leadership, we've passed like serious things into law, like Sexual Offences Act, against gender-based violence. We've put a ban on female genital mutilation, child marriage ban, Women Empowerment Act. Now we're even talking about Reproductive Health and Safe Abortions Act. All of this in 4 years. So sometimes intentional leadership to bring women on board works, and it works in a short time. It may not even be as 10 years or longer, like in the case of India, for example. So sometimes, it may be tokenism, but frankly, if it yields good results for the women and the girls, then we're fine with it. I just wanted to quickly say that. And I had a question for Dr. Lia. Part of the things I struggle with as a new, I should say, women leader, I'm recently appointed Deputy Minister of Health in Sierra Leone, 1 year now. But one of the things I still suffer from is what I'll say imposter syndrome. Sometimes when I walk into a room, you feel like, why do you belong in this room? Why should you even be speaking in this room? So I was just wondering if Lia faced any of these things when she started her leadership journey and how she coped with it. Thank you.
Thank you, Jalikatu. Jalikatu is the current Deputy Minister for Health for Sierra Leone. It's I think a difficult question, but there are days definitely that I would have felt that not sure of myself, but I don't think I would say I had that syndrome. I mean, I definitely know my motive is there to serve, and but also continuously learn. Continuous learning, I think, is a key leadership principle that I have always valued, and having a strong team of diverse team that has different capabilities is something that I always try to have, because I cannot be good at everything. But not with that sense of really fear of not being able to do every day. It was not really, but there are days that can happen, and need to overcome those days.
Thank you. We just had a speaker last week actually talk about imposter syndrome, and one of the findings was that both men and women have the experience was one of the findings, but the other thing is that it can be a source of motivation. It can be a source of motivation to work a little harder to make sure you have it all together. So it can actually be a positive thing, which was very nice thing to see. So I'm going to bring in Mara Bolas next, and then I see Ronnie has his hand up. Oh, Mara, we can't hear you, but I don't know why.
Seems to unmute, but
There you
Now
Oh,
it's okay.
now try again. No. Oh. Unmute, try one more time. Oh, stinker. I'll read your question. I'll read your question. I do have your question here. And feel free to elaborate on it in the chat. Darn, I'm sorry. Oh, Anisha, this is not a problem on our end, is it?
No, I unmuted Mara a few times, I think, and I saw her unmute, so I'm not totally sure what's going on.
Oh, shoot. I'm so sorry, but we do have a question here. Mara asked in the chat, now decades after Beijing's Women's Conference, gender mainstreaming as a strategy is often criticized as not contributing sufficiently to structural change. She said, I'm very inspired by what you were able to achieve. What are your thoughts about gender mainstreaming as a strategy? How best to incentivize broad-based organizational acceptance? And I think also by gender mainstreaming, she's not just talking about getting the women into the position, but I think she was also talking, you had that slide on gender mainstream, and part of that was getting like the gender lens put on some of the budgets and things like that. And so maybe you should talk a little bit about what you thought worked. And I think you also said it was hard. You ran into some barriers as well.
Yeah, gender mainstreaming, I feel it's definitely a critical approach to achieve that lens of the gender lens of in everything we do. But the approach has been challenging because the problem is it is for the most part it is siloed. So we have our in each of the we have its own ministry for women and gender, but also we have gender units in every ministry who are supposed to push this agenda, help every department have that gender lens and the organization itself have that. But because it's given to a certain unit, the problem is that everyone would leave it to that unit as if it's only their work, not so it then does not really integrate well within everything we do. It's supposed to be, at some point, we should not have actually those, maybe what they do could be some level of capacity building and other things that they can do, but not given the responsibility of really mainstreaming gender. That approach, I think we need more evidence to come out to innovations on how best it can be done. But that is the main challenge. They have brought progress. They have brought that push to ensure that our interventions, what we design as policies, programs, are integrating that gender lens. But the problem is that it's become their work.
Yeah, that's so interesting. That's so important. Mara, I'm so sorry we didn't get your voice because Mara is actually an expert on applying the gender lens. And so it would be, I regret that we don't have more free flow of conversation. Ron, can we unmute you and get your question?
Yeah, thank you so much. It's quite inspiring to hear you speak from your own experience. I wanted to see if you could comment on two basic cultural challenges that you've named. One is that you've begun to identify a change in the culture of public problem solving itself, that a lot of the problems you're trying to address in health require devolving responsibility down in a more distributed way rather than relying on autocratic, top-down methods of problem solving. So that in and of itself is a major cultural shift, regardless of gender. Simply, practicing public problem solving or leadership differently. And the second, more obvious cultural challenge is simply having a lot of women in positions of authority, which must be a challenge mainly to men, but my guess is it's also a challenge to women too, who don't see women properly taking those kinds of roles. So I wanted to know, and then just a quick point on Abibao's notion about token. The word token has the same etymology as the word teach. And I think so much of what it means when you're at the beginning of these transitions and you are very much a minority or a singleton is, can you then begin to see your role in a large arc of teaching people over time, even though you know you're positioned poorly, for engaging in that. But so I wanted to hear if you could reflect on both of these two cultural shifts, the shift in problem solving to a more distributed sort of responsibility taking, less autocratic, more distributed leadership in a sense. And then second, how would you advise women? How have you advised women in dealing with the pushback they get from men, both at home, which you've described one case of, and also professionally, when men are now reporting to women as as sort of a very new cultural phenomenon? How do you work with that at the micro level, day to day, where the details matter?
Thank you, Ron. This is definitely a challenging question because cultural shifts are always challenging. Definitely, the approach we take in problem solving and rather than the autocratic or the top-down approach, the collaborative and where we empower teams, it requires a shift not from at all level. I've seen it. People from fear they deliver when they are in that space of autocratic or top-down, and they need time to get used to a collaborative approach. But then you see people really feeling valued and becoming more creative in bringing solutions in that kind of space. When you have that collaborative approach where you are empowering teams, where you are valuing them, listening to them, and engaging different levels to bring to the solutions, then they feel more motivated. Initially, it requires time to transition from that kind of, especially if you're working with or under that kind of leader and shifting to a different kind of approach. It requires time to transition because now they have more autonomy of what they are doing, but they are also, of course, that doesn't mean you just leave it for the team. You have to really have a way of following up and making people accountable again, but really creating that space of collaboration. I have seen it where people were more motivated and also more creative in bringing solutions, and then feeling valued of what they're contributing, because now they are on the table bringing solutions and you're implementing those solutions. You're not just saying, okay, do this. So I have seen it really create more encouragement in a lot of, in many ways. And so I mean, many drivers of change. And in the second one, in terms of when you're having more women, the challenge is definitely from both sides. Both men and women are not yet used to women-led organizations or overall systems, and for different reasons. So for example, you would see a lot of backlashes in social media for women who are leading very well, but just because of maybe something very small, then that becomes a huge thing if it's a woman. But you see it how differently people react. As I said, usually the expectations, the bars would be very high. But also again, with time, people then, once they see you deliver, especially if you are the issue of integrity and that commitment is there, people usually see it and then they change. I've seen that. It requires time. It's a culture shift. I'm sure not just for places like Ethiopia, but even for countries like the US, there is that challenge. We are at a completely different levels for sure, but the challenge is there. So I have seen it requires some time, but the cultures do shift. But that also requires the patience and perseverance from the leaders, the women leaders, when getting those kinds of responses on how we I mean, we have to have more thicker skin to get through those times. But also that's, I think, the key issue. Once you are in leadership roles, it's very important to have, again, mentors and coaches who really take you through that process. Sometimes you are left in the dark, and then frustrations come just because of how to handle those kinds of responses.
Could I pick up there? And I'd like to go, actually bring in another idea of yours, Ron, of going up on the balcony. So in those moments, like, I love the way you phrase that. Like, you can be in a moment where just things feel very dark, you know? And I know from a previous conversation that we got to be in that you talked about the effectiveness of the coaches at times. And I imagine what they were doing is, as Ronnie says, help people get up on the balcony to kind of get up out of that darkness and kind of look down on the situation and analyze the situation. I was wondering if you could talk a bit about how that coaching, why you thought, you had mentioned on this other panel that we were on that you thought that coaching was very effective, and you brought it up now. And I wonder if you could just speak a little bit more to what were those, you know, I don't know if it's a story or some examples of ways in which, you know, these women, knowing that they had this resource to, in essence, kind of step outside of the action and look down on it, how and why that was helpful.
Absolutely. Then the taking times, usually when you are in such roles, you are most of the times in the dance floor. And what you brought, the analogy of really being on the balcony, is something that, again, requires this intentionality. And it could be by reflection, I guess, by yourself as well. But having such kind of coach also is very critical in terms of helping you see it from a different lens rather than from being inside. And then it helps you in the process of reflection, because self-reflecting is one thing, but also having that person who really would take you through the process of reflecting of what do you think went wrong, or how you handle this, so that it gives you really a time to analyze those and look at it from that perspective is really important. And that could be even sometimes it could be just a colleague. It doesn't have to be really somebody senior. Or I've had I was on a process of we were on a process of reorganization of the ministry, which is a very challenging process, which creates so many pressures and reactions. And I sometimes have to discuss with other colleague ministers who are doing similar work in their ministries, and then to get some perspective, and then looking at it from the broader, rather than talking about that individual who went through this process, but looking at the holistic aspect and see from the different perspectives, which was really very helpful. So it may not necessarily be actually a coach, but it could, that process of reflection and anything that can help, whether it's coaching or other ways of reflection, I think is really critical.
It's a beautiful, thank you so much. I think that's one of our aspirations that, you know, in our leadership development programming at the Kennedy School, whether it's in degree programs or executive education, that we're, you know, giving people tools that they can find ways of using, you know, as their leadership journey continues. And so that's such wisdom to find that, you know, find those peers, find the coaches or the peers who can help you pop up and get that perspective. Thank you so much. You have really, again, given us, you know, national level perspective and micro level perspective on such an important challenge. Well, anyways, we're grateful, and we'll continue to track your leadership, and hope we might have you back again before too long. Thank you again, Lia. This was just
Thank you so much. Thank you.
inspiring.
Thank you, everyone. Thank you. Bye.
Bye-bye.